County Administrator, Dr. Theresa Cullen, the Director of Pima County Health Department, many in our team, my council colleagues and I remain concerned about the parallel issues of unsheltered homelessness and the rise of opioid, fentanyl, and meth misuse in our community. These issues are not unique to Tucson or Pima County or even to Arizona, and yet there are particular circumstances that make our situation here in Tucson and in our region unique, including the weather and proximity to the border in terms of the availability of fentanyl in our community. Over the past 5 years, we have created many programs to uh, deal with and help unsheltered community members, including the mayor and council creating our Housing First program, our Community Safety, Health, and Wellness program. We've hired housing navigators and care coordinators, created a homeless protocol tool, which is being updated as we speak, moved our place network investigation pilot forward to make it a permanent program. It's now called the Violence Interruption and Vitalization Action, known as VIVA program. We began to make zoning changes to bring additional resources to create shelter. Our first pilot program is the AMFA Housing First Resource Center. We are currently working to purchase a facility in South Tucson to create 100 additional low barrier shelter beds. The city has put millions of dollars into purchasing hotels and house people first. My colleagues on the council and I passed a resolution in May of this year declaring fentanyl and opioid use a public health crisis, which it is. We've hosted Housing Central Command to help us improve the efficiency of our collective regional efforts to move more people experiencing homelessness into housing as quickly as possible. We've been meeting with Pima County, myself as the mayor, with Chair Grijalva, our city manager, and County Administrator Lesher for the past 2 years, helping ease the processes that we mutually share. And yet, we are still in a crisis. And we acknowledge that all of these efforts put together are making a dent, but there are issues that, frankly, the city of Tucson and even maybe Pima County are not completely responsible for. The city of Tucson has been doing incredible, innovative work to direct resources to these issues. But we have seen some turns in I would say, the last 8 months to a year, where there are two parallel crises happening before us. One of unsheltered homelessness, one of unsheltered homelessness that is accompanied with severe mental illness, and on top of that, the usage of fentanyl and meth and opioid, which is a substance use disorder. So I think we need to continue doing what we have been doing, but branch out and reach out to the most appropriate jurisdictions to help us with behavioral health, substance misuse, and serious mental illness issues that, frankly, the city of Tucson is not an expert in or prepared to do, because that is not within the services that the city of Tucson, not according to our charter and not according to what we have traditionally done to service our community. The city of Tucson are not experts in mental, behavioral, and serious mental illnesses. nor are we experts in knowing how to do or have capacity to do, um, the work that that substance misuse and the crisis that it brings with it to communities like ours should be doing. So, with that, I'd like to call on Dr. Cullen and Chief Casmar. I know also that we have Mari Vasquez, our multi-agency resource coordinator here, Brandy Champion, and others to provide us with information as to where we are, what we have been doing, and I think most importantly, what we need to do to address these very concerning issues in our community. So I don't know if you'd like to introduce the team, Mr. Manager.
Thank you, Mayor, Honorable Mayor, members of the council. Thanks for the opportunity to give you updates on what we're doing regionally. As you mentioned, Police Chief Casmar will give a brief update on activities through TPD's involvement. Dr. Cullen for Pima County Health Department will give a presentation as well. And then we'll wrap up with our resource manager for community safety, health, and wellness, Lee Hopkins, who's here at the table with us as well. With that, I'll turn it over to Chief Casmar.
Thank you, Mr. City Manager, Honorable Mayor, members of council. Thank you and my esteemed colleagues that I get to share the table with that cover what will hopefully cover, again, the complexities of this issue that we're trying to tackle. I'll start with, you've heard me say this before, and it's actually gone up about 2%. 52% of fentanyl in this country continues to be seized in the state of Arizona. What that means is the cartels are highly effective and nimble in the way that they get their drugs into our country. And when we talk about fentanyl and opiates, we should continue to recognize that methamphetamine, cocaine, heroin continue to also be pumped into our country. And most of the folks that we're meeting out that have those mental health and substance misuse disorders continue to be poly drug users. It's just the fact that fentanyl is so inexpensive for far less than $1 a pill if you're buying or purchasing from somebody that you've purchased for before, can get down into the 35 to 50 cents per pill. That's the challenge that we're facing, and that's the reason that we come across so many individuals in our community who are smoking fentanyl out in public or have a pocket full of fentanyl pills in their pockets. So what I want to champion again today is a multifaceted approach of a continuum of care and a continuum of accountability as we try to tackle this really difficult issue that is a local, state, and federal opportunity for us all to continue to collaborate, to work together, to not point fingers, but to regroup, reacquire, and recognize what strategies are working and do more of those, and recognize the strategies that are not working and doing less. This is absolutely a public health crisis. In my 24 years of public safety service, I've not seen any type of drug impact our community like it has recently, both with Vice Mayor Dahl and many of other council members have received, and city leadership have received emails from community members, from business owners that are just frustrated with where are we headed and what does that look like, and the difficulty of the plight that they see related and connected to this devastating drug. I will say that we have we're nearing 4,000 narcotics arrests this year. We are doing more arrests than we did 5 years ago, but we can see that doesn't always have an impact. This is absolutely something where arrest, and I want to dissect, arrest is different than incarceration. When we think about arrest, the officers continue to embrace the idea behind deflection. We've completed over 400 of those where individuals in crisis have made the decision when we catch them with narcotics to go get help instead of going to jail, and we continue to work on that. What we're seeing, though, is the devastating impact and the fact that fentanyl has twice the impact of a traditional opiate. It's very difficult to come off of without medically aided treatment. And so the idea that we continue to meet folks where they're at, provide services, will increase our probability that folks might actually take alternative paths other than to continue to live in the status that they're living. I want to also recognize that's been an ongoing conversation within my organization, in the community, and of course with mayor and council. What do we do, and why aren't we arresting folks who are smoking fentanyl in broad daylight? And there are some complexities that go with that. For one, we need to recognize it is against the law to have fentanyl and to smoke fentanyl in our community. When an officer comes across that, they have the opportunity, if they're not on a higher level call for service, to try to impact the person that's committing that offense. There has been a conversation around, is there a 2-hour or a hard 2-hour rule at the Pima County Jail in relation to NAF care rules, which is the medical services provided within the jail, that somebody can't be booked. What I will tell you is that in my recent conversations and looking at data for this year at jail, well, we're averaging about 1,500, just over 1,500 occupancy at the Pima County Jail. And what we see is about a ratio of about 50 folks per day. I'm sorry, 50 folks per month who are rejected. And about out of all those, about half of those are ours. The number one rejection as we sit here right now is hypertension. So I know you wrap your head around that for a minute. And so if again, it's where they're looking for high risk folks who could have medical crisis within the jail. But if their blood pressure is greater or equal to 200/120, that's the number one rejection. So what will be, what I spoke to the sheriff about was our officers need the ability to effectively make arrests when they need to and to drop somebody off at the Pima County Jail. If they're in any kind of immediate kind of health crisis that my team are evaluating, they're certainly calling our Tucson fire partners to come out and do that field triage to make sure that they're safe to transport. But at that point, what we're looking for is meaningful health services within the jail for us to safely drop that person off and for them to be reviewed by an expert before they hand that off. So those conversations are ongoing. I will also say that conversations are ongoing with the Pima County Attorney's Office on thresholds in what capacity that Ms. Conover's team has to actually process an amount of cases that, frankly, we're not staffed for and the county's not staffed for. And so we're all having to recognize what investments need to be made so we can better process this. So when we look at program development for post-arrest, but pre-conviction and trying to leverage folks into treatment. So with that, I'm going to pass the mic over to Dr. Cullen.
Thank you, Chief. Thank you, Mayor, members of the council for inviting us. We believe our relationship with the city of Tucson is critical in our ability to react, plan, and mitigate the opioid situation, the overdose situation, as well as this recognition that it does not occur in a vacuum, which is what I think the chief just shared. There are multiple factors that are contributing to the ongoing crisis with fentanyl, the ongoing overdose crisis, including poverty, unhoused, chronic mental illness, serious mental ill, access to care. So I'm going to briefly run you through some of the statistics we are seeing because there is some success happening, and I think that much of this is due to the work that we are doing together. There are still lots of challenges, and as we move towards the future, what I would recognize, and I stated this on a call this morning on a national call, is that we are in a unique situation here. We work together. We share data, we can respond together, we plan together, we can track interventions together. And hopefully together, we will be able to solve some of the problems that we are seeing with some novel solutions that I will say I'm not sure we've thought of yet. But let me share with you the news that we are seeing, and you may have seen this because it's been published nationally. We are seeing a significant decrease in overdose deaths in the United States. Pima County in 2024 has seen a 17% decrease in overdose deaths. Now, at the same time, we are seeing an increase in overdose visits in the emergency room. That is probably positive because what that means is people are showing up at the emergency room alive and getting appropriate intervention. As we know, for most of the opioids, that intervention is Narcan. We are also seeing very significant decrease in juveniles, 17 and under. Last year, we had 7 deaths at this time. We have had 1 so far this year. We had seen a spike in the 50 to 80-year-olds that we were really worried about, the coupling of that perhaps with loneliness, perhaps with access to care, perhaps with limited resources, the heat. That seems to have mitigated this year, and those numbers have all dropped significantly. We will make sure you guys get copies of all these numbers. We are also launching our website very soon that have numbers. That website is Opioid Response, Pima. At the same time, the Office of the Medical Examiner data is always up to date for opioids, and you can sort it by the different kind of medication, the different kind of illegal substances that people are taking. So what are we doing? We have given out 22,000 doses of Narcan this year so far, just the Pima County Health Department. There are other people that are distributing Narcan. We also give out xylazine testing and opioid testing strips. The hope is that they are being used. The numbers are small, 6,000 to 7,000 in there, but the fact that people take them at all means that people want to live. They may be abusing drugs, but they're looking specifically to make sure what is in the medication they are using. The other things that are going on is increasing peer support. We've worked really closely with Lee, and we plan on continuing to do that work together. We have an anti-stigma communication campaign. That is critical, not only for the individual, but for the families and the communities, so that when people see someone who may be suffering from a fentanyl crisis, they may be more likely to call someone to make sure that they seek care. We're also closely working with our provider community. We know that there are a significant number of providers that, for multiple reasons, do not feel comfortable prescribing medication-assisted treatment. We do not have enough providers in the community to do that. The vast majority of that work has historically fallen to psychiatrists and addiction medicine people. We need primary care to get comfortable with prescribing MOUD and treating some of the addiction issues as a chronic disease, which is what happens. For those of you who know methadone, people can stay on methadone for their life. They work jobs, they go to work, they are very successful individuals in the community. And so our goal is to make sure that we can increase access to those kind of services, which is huge. We are creating a Southern Arizona Chronic Pain Task Force. What we believe, and the data would show this, is that many people end up in the substance misuse, substance abuse network because they have had inadequately treated pain. When we look at our overdose data by occupation, we see a disproportionate number of people that are employed in the trades industry, in the construction industry. Makes total sense. Those people may have an accident, they may have an injury, and they may eventually end up with an opioid addiction, but really started with, how do I treat my pain situation there? We have done a significant amount targeting the youth. We have talked previously with you about prevention and how critical that is. With the older population, our prevention is, why are you using? Is there loneliness? Are there other things we should be doing? With the youth, the campaigns are a little different. What are we seeing? What are your risk factors for that? How can we make sure that you have resilience in your community, in your family, in your individual, as well as giving a lot of education. Behavioral health ties in closely here. The You Are Not Alone campaign is really geared to say to youth, you are not alone. There are services available for you, and we have put a significant amount of our $207, our marijuana tax money, into that. So we also have done a needs and assets study. I have talked about this before, and now I actually have a copy of it. We approach this from not just what are the needs in the communities, but what is the strength and resilience in the community. And we will make sure that you guys get a copy of this. There are many opportunities for us to work together and for the county health department to respond to what happened here. This was conducted primarily with interviews. We've done multiple surveys, but these were interview groups, not only with providers, but also with unhoused community members, to try to tell us what is working and what isn't working for you. Finally, we have the Substance Misuse Committee, or the Opioid Committee, which we are going to later. We have our third meeting today. You will recall that the City of Tucson, the City of South Tucson, Marana, and Pima County are working together to come up with ways to expend not only the fiscal resources, but the human resources that come along with the opioid settlement dollars. As of this point, the county has received approximately $18 million. The vast majority of that is unspent. The spending has focused on Narcan, provision of care to women who are pregnant and are suffering from opioid use disorder, and a very recent contract that's being let to expand MOUD and treatment into the community through a mobile unit. There's many people that are unable to get to a facility where they are able to initiate MOUD and then have multiple barriers to stay on it. However, I think as we look forward, our hope is that the opioid committee will look at multiple other opportunities that have arisen for us to work in the community. I will say that the number one area that is of most concern is the justice-involved population in terms of trying to figure out how do we initiate MOUD and behavioral health. The Department of Behavioral Health at the county has done that in the jails, but then how do we keep people engaged in that, and how do we give people a runway and a transition plan where they will be okay? At the same time, I would be remiss if I didn't talk about the unhoused population. We know the unhoused population is at risk for overdose. We know that there are a higher use of substances in that community, not necessarily opioids. People are still using methamphetamine, cocaine, heroin, but our ability to be able to touch that community from a public health perspective is critical. We know that that community, just like we know there's other populations that are more at risk based on our demographic data, we know that the unhoused population is probably at highest risk for overdose. And we are trying to identify what are appropriate interventions for that community. I would reiterate what I said last year. We're not buying ourselves out of this. However, we are seeing a decrease. If you ask me why, I can give you a litany of reasons, and I have no idea which one of those is the causal relationship here. We definitely believe Narcan in the street makes a difference. There's a new measure that looks at how much Narcan has been distributed per 1,000 people in a community. We're so lucky that we've been working with TFD and TPD to identify high-risk areas, not necessarily of unhoused, but where we're seeing overdoses so that we can do what we call hyper-local work. Obviously, everyone in the community is affected, but our ability to target populations when we know we have limited resources becomes really critical. So I'm going to close with that. I just really want to give a shout out to the work we've been able to do with the chief, with EMS, with the responders, with the healthcare providers, with the general community, with the NGOs, and finally with Lee. Thank you.
And Lee, if you'd like to add your comments.
Thank you. I'll give just a brief update on how community safety, health, and wellness has been investing in this space as well. So I wanted to just share some highlights over the summer from June 1st to August 31st to give you a sense of where we're at, what we're seeing. So in that period, we responded to 555 311 calls. A subset of the total 311 calls, and the calls that are sent to our team 7 days a week, are responding to social service needs. And so among those needs, we're seeing a large percentage, almost 50% of people are housing insecure, at risk of homelessness. And so although that is tangential to the conversation we're having. And so a lot of what our team is doing is helping folks navigate how to stay housed to prevent additional families from being on the streets. In addition to that, about 25% of the calls are related to emergency shelter. So we do depend on the shelter system as it is, and sometimes are able to advocate and help folks kind of get a backdoor entry, but also sometimes simply depend on the regular intake process. And also about a smaller amount, about 4% of folks are seeking out behavioral health services, detox, and substance use treatment services. And so that aligns also with what we're seeing as far as the voluntary interest and seeking of behavioral health treatment and medication for opioid use disorder. We're seeing it at a much smaller rate than we would hope. And so the way that we address that is really just meeting people where they're at. And about 14% of those 311 callers we kind of hold their hand for a longer time and guide them through some of the complex systems that they're trying to navigate. So in the summer, we also worked with 131 individuals from across Tucson with longer term care coordination. Again, the major need was related to housing instability, either helping folks stay housed or helping folks move from the street into housing. Sometimes very complex, with folks who have 3 evictions on their record, or, complex family dynamics. Just today, we were able to move someone in. Anthony, one of our care coordinators, is doing that this afternoon, and this individual worked for a month and a half applying to countless apartments because the family had 3 evictions on their record, and finally were able to find a landlord that will rent to them. And so the team also has leveraged over $75,000 of both funding that we were able to access through a Housing First grant, as well as $30,000 from community-based funds, including Ward 3 grants and others, to either help folks move in or stay housed. And kind of going back to where we're really trying to meet folks where they're at when it comes to opioid dependence and other self-medication using drugs, is really just trying to use our trauma-informed approach, meet people where they're at, show them that we're ready when they're ready. So even though that's not today, they can call us in a month and we'll be ready to walk them through the next steps. With our neighborhood-based work, our community enrichment coordinators have made a lot of inroads in opioid awareness and prevention work in both the Thrive sites as well as the Viva sites. So over the summer, 300 residents were served in the Viva neighborhoods with Narcan and fentanyl test strips, thanks to our partnership with the health department, who attended 4 of our resource fairs that we had in the sites over the summer. And additionally, we had 2 Narcan awareness events. So we have tenants, especially from those big apartment complexes, coming to those events, and of all ages. We also work closely with partners, and this summer we did a summer camp at one of the South Campbell location apartment complexes for youth, and one of the themes of that summer camp was addiction education and prevention. We also worked with the health department to install Narcan dispensers because the Viva locations also are areas with the highest rates of overdose in the city. And in our upcoming Community Safety Leadership Training Institute, which will begin next week, we have a whole session called Rise to Fentanyl that will be delivered by one of our partners. And so really, that institute are community safety leaders, residents of the Viva sites, who will be going through this 8-series institute. And during the Rise to Fentanyl session, really be equipped with the trauma-informed, destigmatizing tools to help their neighbors on an individual and community-based level. In Thrive in the 05, just last week, we had a fentanyl-focused workshop for the Tucson House Safety Committee so that they can educate their peers within the Tucson House. And we also have been involved in along with Ward 3, in facilitating neighborhood dialogues about an upcoming addiction treatment center at 11th and Flores. I'm open to any questions you have, and thank you.
Mr. Manager.
Thank you, Mayor, and thank you to the team for the presentations today. I also have with us today Mari Vasquez, and whether it's now or in a few moments at your pleasure, she can give an update on our activities today at Santa Rita Park. So would you like her to proceed now? Okay, so Mari, please come on up.
Good afternoon, Madam Mayor, Mr. Vice Mayor, and council members. Happy to provide a brief update on the outreach and cleanup effort that we did today at Santa Rita Park. The cleanup began this morning and will continue till 10 a.m. on Friday when the park will be reopened. The cleanup was required to preserve public health, safety, and welfare, as noted by many departments, parks, TPD, and our outreach teams. Additional outreach to the community members in the park began earlier this month with a significant outreach that was conducted within the last 2 weeks. Many thanks to the Pima County Health Department's mobile unit that had been out with us several times. Outreach teams continued to be on site this morning to ensure that any unhoused community members who wish to access available shelter and housing were able to do so. Some of the partners included the City of Tucson Housing First, Community Bridges, Kodak, La Frontera, Hope Inc., Sullivan Jackson, Community Workforce Development, the VA, CMS, Community Medical Services, American Rehab Campus, which we call the ARC, Old Pueblo Community Services, and our multidisciplinary outreach team, which had several nurse practitioners. 78 individuals were contacted by the outreach team on September 20th. Prior to that, the previous Friday, we had contacted 40 individuals. More than 50 individuals were at the park this morning. Not all were unhoused. We had about 15 people advising us that they had housing opportunities, but were hanging out with individuals that were encamped in the park. None of the individuals that were contacted last week or today accepted any shelter options. They did take the Narcan and the fentanyl test strips, but no shelter options were accepted. We did have 4 initially decide to go, but as it was time to get them in the car, they refused services. We did have low barrier shelter options, as well as other options that may have had some higher restrictions. And again, those were not taken. Emergency medical aid was provided by TFD to 1 individual that was found intoxicated on the premises and was exhibiting symptoms which others felt like needed to be treated by medical teams, and he was responsive when they got there. No arrests were made during the outreach. However, there were some TV stations and social media representatives filming the cleanup and a small protest activity along 22nd. There were significant hazards found at the park, which were abated during cleanup, including an unusual number of needles indicating polydrug use, 1 deceased dog, quite a bit of rotting food, and other hazards that we encountered. All 3 areas we originally were going to see if we could just do a section of the park. The entire park did need to be closed down. City workers did collect property, including tents, bicycles, and walkers to return to their owners if they come and pick it up. They are all collected and tagged, as well as marked for people to go pick up at Thomas Price Center, which is where we're holding items for 30 days. Let's see. The park cleanup work, as it's closed, will include major cleanup of park areas, walkways, restrooms, dugouts, and identified needs like removal of graffiti, painting of damaged surfaces and park amenities, as well as repair to damaged fencing, turf areas, into irrigation, restrooms, etc. Let's see. The outreach and cleanup effort was collaborated by and coordinated by myself, the multi-agency resource coordinator, but collaborated again between HCD, our community partners, TPD, TFD, parks, and environmental and general services. Overall, it was an efficient operation since all of the resources between city, county, and community agencies were present, and happy to answer any other questions that you may have.
Any questions, comments, my council colleagues? Councilmember Funes. And then Councilmember.
What services, how? What services?
So we had both detox services available and housing shelter services. CMS was actually offering Suboxone treatment in the field. And then we had medical services provided by the El Rio nurse practitioners.
Requested, right? Nobody requested services?
Nobody took services today.
Council, thank you, Councilmember Funes. Councilmember Ulick.
Thank you, and thanks to all colleagues here who've offered us some great updates and information. I appreciate addressing both issues in terms of the unsheltered folks in our community. I'm, the fentanyl and opioid crisis, I agree with you, Mayor. It seems like in the last 8 months, I'm very happy to hear we're seeing fewer overdose deaths. It does seem like the walking wounded amongst us and the suffering and the use is really intense. And in looking through stats from different teams and sources, I do want to make sure that we don't conflate the two issues. I know that there are a significant number of unsheltered folks using drugs, but even in some of these more recent engagement efforts, it looks like a third to sometimes a half of folks who are very out in public at the bus stops, in the parks, et cetera, using are not unsheltered. And so I'm very, very anxious and excited to see this collaboration come together to intensify our efforts. Super excited to hear about the mobile unit. Because I believe that many of us want to know what to do when we see somebody slumped over in a bus stop, clearly inebriated in 110 who do we call? And who's going to go engage with that person? I think our community needs tools to help. I also did want to ask whether I worked with Arizona Complete Health for a number of years. They're our regional behavioral health authority. And as I engaged with them, they mentioned the CRC and CBI and other resources that ought to come into play, even assisting our officers so they're not tied up trying to get somebody into treatment and having to wait for hours. Are they at the table with us, and could we invite them to the table to make sure that the Medicaid system and the REBA are really brought in as partners?
Mayor and council, these are great points. Arizona Complete Health, the Crisis Response Center, they are at the table. They're not the appropriate choice for everyone. And so I think what you are highlighting is this need for a really sewn well together patchwork quilt that takes everyone where they are and responds to what their need is. It is definitely true that the walking wounded, the individuals that are using who are not unhoused are a critical component of what we are seeing. And I think Brandy's report kind of showed that there were people that were just at the park, that they weren't unhoused. So that number is a striking number. As we move forward, we have had engagement with state Medicaid with access because there are some significant changes coming October 1st about housing availability for those who have certain diagnoses. They have to be on Medicaid at the time for them to be able to access up to 6 months of housing if they are unhoused and to access different services. And Lee and Brandy and I have talked recently about some other models we are seeing in other cities, specifically San Francisco, where when people need help, the help comes to them. They're not transported to the crisis response center. There's someone that can go to their home. Now, all of these are labor-intensive, fiscal needs that will have to be addressed. But as we look forward to the decisions to be made around the opioid settlement dollars, I think that there are opportunities there. But what you are pointing out is so critical because it says we have to meet people where they are. And while I, like you, am very happy that deaths are down, I don't think use is down. And so I don't want us to conflate those two because it's easy to conflate them. And there's no indication to me that utilization is down. So thanks.
Councilmember Lee, and then Councilmember Cunningham, Vice Mayor, and then Councilmember Santa Cruz.
Thank you, Mayor. I really appreciate all the updates and the collaboration that we've talked about today. One thing that I heard Chief Kazmar as well as you, Lee, mention was the involuntary acceptance of services or treatment. And so I know it's a controversial topic on forcing people to seek treatment, but Chief, you said 4,000 arrests were made and only 10% of those folks opted to get help. You said 400, and you said only 4% of the 311 calls were folks actually wanting services. And so I guess it's kind of a question on, are we, other than the fact that it's very difficult to go through a detox program, and it's probably not the first thing I would want to sign up to do either, are there any ideas on what we can do to get more people to opt in, whether that's Madi or anyone here? Because it seems like if we could even move the needle on that number, that would be really significant.
Honorable Mayor, members of council, Councilmember Lee, I think one space that I continue to have dialogue with my professional colleagues in the region and the Pima County Attorney's Office is there's no set hard threshold, but it tends to be around 10 pills. If it's less than 10 pills, we typically see those drug charges dismissed in initial appearances. And so what I've called for is an evaluation of system resources so that we can actually still utilize those arrests. One pill can kill. 60% of fentanyl continues to have lethal doses of fentanyl, although the cartels have gotten better at making it and more consistent. But what we do know is option number one, utopian, is that folks are ready to get services without being leveraged into treatment. But we don't live in a world where we can continue to allow 5,000 people impact a major metropolitan million people in our community. And so we do, in my opinion, humble opinion, need to continue to look at systems investment. And so county attorney has a resources to, staffing resources to process the amount of cases that we're putting forward in conjunction with looking at programs like STEPS that we've discussed many times at this table before, which is a pre-conviction, post-arrest pre-conviction drug rehab process where, again, that, it's a system that has tolerance for setbacks and mistakes. Those of us with loved ones that have lost their lives or continue to struggle with sobriety recognize there's going to be setbacks. And so if we build systems that can adapt to that, I think we'd be better off. And I think Dr. Cullen did a great job of articulating, and it's certainly the sense that your PD staff are seeing out in the field is that this problem is scaling and it's getting worse, not better.
Councilmember Cunningham, and then Santa Cruz.
I got a few things. 400 deflections. Are we tracking post-deflection success? In other words, how are those clients that are getting deflected doing 20 days later? What's the washout rate on folks going to rehab for deflection and then leaving deflection 5, 6, 10 days later? That's something we really need to track. I'm not saying we need to track it to be punitive to the people who quit deflection. We just need to know that we're not taking the same 6 people to deflection every month. I mean, not that we are. I'm just, so you talked a little bit about I have stuff for Chad, Dr. Cullen, the chief, Dr. Cullen, Miss Lee. I got stuff for each of you, and Madi. I'm not leaving you out. So
all good.
let me get through all these. What percentage are we taking to CRC? I mean, does CRC have the detox bed capacity for folks we're taking when we take them? If we don't take them to jail or jail doesn't accept them, we take them to CRC. How many of those are we doing a day?
Honorable Mayor, members of council, Member Cunningham, the Community Response Center, Crisis Center is particularly our staff are taking folks who are in mental health crisis, not substance misuse crisis. So typically we take folks to Kodak if they're dealing with substance misuse disorders.
I had a discussion with a community member yesterday who thought we were taking everybody to the CRC. So I just wanted to try to get that on.
It's a fair question because sometimes it's really difficult to separate whether somebody's in mental health or substance misuse disorder crisis.
But it's not an alternative if someone isn't going to. It's not a jail alternative necessarily at all.
It is an alternative to jail if somebody's in mental health crisis and the officer, and we've been doing this for 3 decades, that feels like that is the best place for them to be, and then we long for them the arrest.
All right, but okay. I'm trying to say that is that 90% of our arrests that we're going to the CRC? Because that's what was made to sound like to me.
No, sir. We've probably processed 200,000 calls for service that have resulted in about 14,000 arrests. So you can see those numbers are low. We actually, arrest is a fairly low tool that we use.
All right. Congrats. Congrats on lowering the ODs. This is for you. But how are we able to, do we have a mechanism to track 30-day, 90-day daily use? Do we have any pieces to that?
Honorable Mayor, Council.
I don't have to do the whole
No,
thing.
I don't have to do all that. Okay, good, because I always forget how to do it. No,
Okay.
we are trying to put in process, in a sense, what we would call a journey map. Somebody enters in the system and you can enter into a data system from a zillion different ways, right? An EMS call, a loved one, an ED visit, an overdose, somebody seeing you at Kodak, then what happens to you longitudinally. So we are in the process of trying to pull something together that will enable us to do that. But right now, we don't have great.
And I'll get to that. That's kind of the puzzle.
And council member, I'll just remind Mayor and Council, the $1 million that you just supported to fund the expansion of the data lake in conjunction with my partner Crime and IT and our TBD partners and county, and Dr. Cullen alluded to that earlier, that the data lake that we've built will allow that type of congregate data to be shared.
Okay. Do we have, I saw that we had some Suboxone. I'm assuming you guys are working some Suboxone things and methadone. Are we doing buprenorphine as a third alternative?
Yes, those are all available. Some of them depend on the insurance of the individual, but they are all available and what people choose. There's also some long-acting medications that are now out there that we believe will be really critical. Medicaid right now does not pay for those. However, we've been in discussion with them because what we believe is that may decrease craving enough, may make withdrawal a little more tolerable, and we'll be able to get people on.
And so this one's going to be a little controversial. I'm not taking a stand here either way. I just am asking. I understood that there's some cannabis discussion about making that as an alternative for people trying to detox from opiates. Are we doing any of that research or participating in any of those things?
We are not directly, but we work with the Center for Pain and Addiction Research at the University of Arizona, and they are doing some of that right now.
Okay. I was just curious about it because as I was reading up on the 4 different alternatives, it's starting to come in, which like 20 years ago would have been sacrilege. And now it's a pretty interesting discussion to have. Okay, so we had 551 referrals over the summer. That was over about 90 days.
Yes, those were 311 calls, 555, and then more intensive care coordination.
Can you turn on your mic so that the people at home can hear you?
Pardon me. Yes, 555 311 calls were responded to, and then additionally, there was 131 folks who got a bit more intensive care coordination.
On those 311 calls, are we responding in person with the social worker?
We are responding over the phone, calling them back within 24 hours. And it's a member of the community safety, health and wellness team. So it's a care coordinator calling them back.
So, but do any of those calls end up with one of our team going to the field? I'm just asking.
On a case by case basis?
Yeah.
Yes,
Okay.
if needed, but it's rare.
I just want to. And we also have folks with MDOT going to the field daily still?
MDOT's in the field daily.
Okay. So there's a couple things one of the things that got talked about that I think we can control at this table is someone mentioned about people calling for detox. I don't know enough about the entire system. What I know is that we've listed 15 different agencies. We've got 3 different entities funding things. My opinion is this. Without complicating the discussion, we should probably set a goal to have a plan. I know I hate having to say it like that, but I have to say it like that. I'd rather just say set a goal and this is it. I want it to be able that if somebody calls for detox, they can get picked up and taken to detox within 4 hours. That should be within our realm to get there. Go ahead.
That can be done by our team, as well as Housing First team who responded through and one calls. And also there are crisis mobile teams that can be dispatched by the mental health crisis line that are access funded for that specific purpose.
And I don't really care who does it. I'm just saying, in the city of Tucson, if you want to go to detox, you should be able to get there within 4 hours. And we should be able to do that. We should have the bandwidth to do that, period. There shouldn't be any more discussion about how it's done or who it's done by or whose responsibility it is. I don't need a finger point circle.
Councilmember Cunningham, do you have any more questions?
Yeah. Sorry, I'm going as fast as I can. The second piece was, the last piece is that, okay, so the puzzle piece. So we have a data puzzle with each client we're engaging. And then we also have a computer puzzle because there's a health service computer file on them. There is a court and law enforcement engagement file on them. And then there's also a social services file on them. And it's a digital footprint in different computer systems. And I think one of the biggest pieces is how we get them to, and finally there's a court file on them. And we have to have them talk to each other. One of the things you talked about was we have people with under 10 pills, so the case gets dismissed. But if they have multiple engagements with law enforcement in a 6-month period, can we treat that as a clinical piece in how we divert them to mandated care? And can we work with the county attorney to work with some model like that? And is there a model that exists? That's a question for all of you.
Well, let me respond to the data piece because these guys are amazing. I'm pointing to the chief and the police department. And we just a call today for an hour and a half trying to figure out this puzzle and figure out, that's why this journey map of where the individual goes, the ability to follow the individual, obviously the family too, is critical. We are working on that. That is a very difficult area. And, but I just want you to know we have to do that. We know we have to get people when they enter into the system. And the health system piece is critical. We're actually working with one of the major hospitals to do some predictions about that. So I think that will be solved. It will be solved on a small level originally, and then it will be solved from a macro
The
level.
interagency puzzle and how it interacts with court and how we can do diversion like on site. One of the things we talked about was the digital hearings. Are we closer to that where we're able to do video by court on warrants and stuff like that?
I'll bypass the formality. Yes, sir. We're getting closer. And you bring up a great point, Councilmember Cunningham, that city court plays a key role. We often talk about the felony aspect of our county attorney partners, but through community court and investment in our own court resources is an opportunity to expand impact.
All right, that's all my
right,
stuff.
Councilmember, I think that what you brought up is in your last question is really important because that's something that I'm sure all of us have been asking for the last couple of years is what is the map, right? There are huge gaps in the map that we're creating. And even though the city of Tucson has created incredible and innovative and data-driven evidence-based programs, we still have this issue of severe mental illness coupled with substance use disorders, and we're seeing people out in our community, and there's evidence there throughout the city. And so I feel that we need to create a possibly like a gap analysis in terms of this is all we're doing, and all of the work, both the city and county, we're working together, all these innovative programs that we've created, but there's gaps. And so concerning the Santa Rita Park issues that were happening there, my question has always been, but where do we take these individuals that obviously need help? The first step is for them to accept the help, right? And so if there's criminality components, are there ways that we can leverage arrests to have either court mandated or any other way, right? So there are absolute gaps in what we're trying to do. And so we need others to come with us. We need the county attorney to come with us. We need to make sure that the courts are aware of what we're trying to do. And then we need places for detox. I think that beds, low barrier shelter beds, but also beds for detox, voluntary and involuntary, unfortunately. So I guess I'll let you think about it in terms of others asking some questions and having concerns. But ideally, what I would like to see is a gap analysis where you are all that are doing the work, um, help us put together that map, help us find those gaps, and then also find the jurisdictions that are responsible to help us with those gaps. Because the city of Tucson, we are not responsible for mental and behavioral health. We don't know how to do it, and we don't have the capacity to do it. So who is? Councilmember Santa Cruz, and then Vice Mayor.
Thank you, Mayor. City Manager, I know you and I spoke yesterday, and I'm frustrated and disappointed on how the sweep that happened at Santa Rita Park went about this morning. You and I have been having conversations over the past couple of weeks about what's been going on there, and I felt like I was blindsided to find out about it yesterday. It's a park that borders Ward 1, and a lot of our neighbors have used the park in the past, have concerns, and so to not be somebody that was informed ahead of time of what was happening and could kind of help with that is really, I'm really disappointed. The conversations that we'd had with you, with staff, was that it would be a layered approach for how we would go about closing down the park, because we all know that in the community was well aware that there's construction that would be happening. So we understood that in October, a portion of the park would be closed, and that would continue to be the phases till we got to late fall, early winter, when the construction would start. And so I was blindsided to find out yesterday about the sweep that would be happening this morning. And I understand, because so many of us have parks, have areas in our districts where there are encampments, and there's a lot of frustration from neighbors about all the activity that they see, and specifically in parks. And I've been on the record about saying that I believe parks are recreational open spaces that are for everybody to use. Once you use them as shelter or housing, they no longer are recreational open spaces, and so we need to maintain that. So I think we have this we've been allowing for these park spaces to kind of get out of control, and then turn a blind eye till it gets out of control, and then we come in and do enforcement with an iron fist, instead of when we've done these sweeps to do ongoing maintenance so that it doesn't get to that point again. So I'm not sure what it is that needs to happen so that we have clarity and consistency in how we're going to enforce park rules or criminal behavior that happens at parks. I think that's part of the frustration with both ends of the community that we hear about, that there isn't any clarity and consistency when it comes to that. I am frustrated because I feel like we talk about these hypothetical low barrier shelter options that we have, and I would like to know how many actual low barrier shelter beds do we have, because it's what I understand is what the city's capacity with low barrier is limited, and so then we're kind of leaning on other partner nonprofit organizations that typically run higher barrier shelters to provide low barrier shelters. That's not very clear to me, and also not very clear to the community. So I think we need to do a better job with that. At the end of the day, I think a lot of the colleagues have covered a lot of it. We'll continue to have ongoing conversations, but I think also what is missing, aside from that gap analysis, is that it's not very clear what our goals are in addressing unsheltered homelessness, what our goals are in addressing the fentanyl use. We aren't clear of what our tactics are going to be in addressing those goals, and then what are our metrics. And so I think we can be having data-driven programming, but we're not actually have metrics or goals that we're trying to address. So I feel like we need to have more clarity around that. That needs to be documented, and then we all need to know how we're gonna get there. I feel like our community deserves that, and we need to know what kind of path we're forging for us.
I totally understand the frustration. I think all of us are frustrated. I'm pretty sure the neighbors around Santa Rita Park are equally frustrated with what was happening in front of their home. I don't know where the communication breakdown happened, but that shouldn't happen. I think we're all on this table interested in terms of how are we dealing with issues that are happening like Santa Rita Park, right? I know for a fact I take pictures when I see stuff, and I send them sometimes to the chief, sometimes to the city manager. I sometimes report them to Mari, but I make staff aware of what I'm seeing and what my concerns are. There are hot spots like there are, or there was at Santa Rita Park. There's 6th and I-10, there's Grant and I-10 on the loop. There are part of the loop that connects from 22nd Street to South Tucson. There are hot spots that we should absolutely report, just like any other resident. We ask any other resident to report. Mr. Manager or Mari, what type of work was done at Santa Rita Park beforehand to offer resources? And are there any nonprofit organizations that are partners that have been trying to work in offering resources to the people that were encamped at Santa Rita Park?
Absolutely, Mayor, council members. We did have, the list again, so again, Housing First, CBI, Kodak, La Frontera, Home Inc., Sullivan Jackson, VA, CMS, American Rehab Campus, and then the multidisciplinary outreach team with El Rio. We really, I mean, once, the complaints and the reports coming into the dashboard, so now anybody that reports, all the reports go into the dashboard, so we have data to show where we are in the tiered system with things. With parks, we have never tiered those in the past because they've had an opening and a closing time. And so what's happening is we could only address those after hours. And when something gets it to the untenable situation that was happening at Santa Rita, the parks director does have the authority to close the park so that we can get a handle on that. We knew that was happening, so we worked diligently to get those services for 2 weeks, different times of the day. So it wasn't just in the morning, it wasn't in the afternoon. And so, but at some point we have to have a response to it. And that was the response that happened today. And moving forward, I think I will make sure. Yeah.
Maria, I know for a fact that you and your team and the Housing First team and the Community Safety, Health and Wellness team and Pima County and TPD and so many of the team within the city of Tucson, some of our nonprofit partners, we've been working fast and furiously and spending millions and millions of dollars. It's not that we don't have goals or metrics. It's that the problems are changing before our very eyes. That's the difference between finding solutions for our unsheltered that are open to being helped and those that are the walking wounded, as you say, right? That don't want anything. How many people today accepted any resources?
None.
How many people accepted resources that were encamped at Santa Rita the previous 2-3 weeks that the services were being offered?
Like I said, many of them took the Narcan and the fentanyl test strips. We had one person that did connect back to getting on like a Suboxone treatment, but other than that, nobody took services. And I will tell you the frustration that we are seeing with our outreach workers is that we can't even get to the point with a lot of them to have a housing conversation because of the high use of substances that we're finding. So, I mean,
So I guess my question is, maybe Dr. Cullen, you can answer my question. Which jurisdiction is responsible for dealing with severe mental health issues, behavioral health issues, and substance use disorders?
Honorable Mayor, Chair, council members, I actually don't know the answer to that right now. I know that if you look through the community, when we did our needs and assets assessment, we looked specifically at behavioral health as well as substance use disorder. The vast majority of behavioral health services in the county, independent of the Crisis Response Center, are within the healthcare system. So that they are within some psychiatric facilities that are inpatient, and then with the provider community. And we have been in dialogue with the psychiatric community, the psychiatrists, to help guide us to figure out what the next steps are. But right now, I don't have a great answer to that question.
Lee.
I'll just add, the Regional Behavioral Health Authority is the overarching regional body that is access funded and is responsible for that sector. And overseeing the crisis response system, the court-ordered treatment for mental illness system. And one thing, because we've talked a bit about, voluntary versus involuntary, I'll point out where we are able to put, when a family member or an agency or any individual is able to petition that someone get a psychological evaluation and then be considered for court-ordered treatment for mental illness, that does not exist for substance dependence. So you cannot mandate for someone to get substance use treatment, whereas you can, based on the decision of a judge, for mental illness.
That's a really important point to make, because I believe that's where the state comes in, and or the federal government. And so that's why a gap analysis is important, because who runs the Regional Behavioral Health Authority, and how can we bring up the flag and say, please help us.
Yeah. And that's Arizona Complete Health. And I do have some more information from them on, these different pieces, but I agree mapping that and figuring out what's not happening that ought to be, because they're on paper, right? Anybody can go to the CRC or to CBI and get in within 2 to 3 minutes, right? On paper, those are the understandings. How's that looking out in the field? How are our officers doing and our teams doing with making those connections? So I think Arizona Complete Health will be very cooperative and ready to problem solve with us.
Yeah, and I also think that there might be some additional possible state legislation that could help us through these points where we can't court order any type of program for a person that's going through substance misuse and addiction issues. This is a super important conversation, and we are way over our 25 minutes allotted, but I know the Vice Mayor has questions, and I do have more questions, but I think we need to continue this discussion. I also would like to ask that we start preparing a gap analysis with those that are at the table, whoever you feel, Mr. Manager, needs to be at the table to help direct our resources strategically. We did not get a chance to talk about the opioid settlement funds that we have money for. The opioid settlement funds, you said we have about $18 million in the bank right now. Could those funds be used for a place? I know that in my conversations with Chair Grijalva and County Administrator Lesher, we've toyed with the idea of the possibility of having a detox facility at the Mission Annex building that is now being used as a cooling center. I would highly recommend to my colleagues on the council and to the task force that you all put together to really think of the possibility of using some of those millions of dollars into a facility to help detox. I don't know who needs to, I know less than you all, right? In terms of who needs to staff it. But I think that could be a possibility of an initial contact to start helping individuals that have severe mental illness and or severe substance use disorder. Vice Mayor.
Statistic. Ward 3, when we look at Mari statistics, we're beating all of you. We have more encampments, more problems. We're getting constant concerns from businesses that are being affected, I think mostly by the drug-induced crazy vandalism that's going on. So think of Ward 3 as a welcome place to come do your stuff. And I want to thank the chief for the involvement of the police with our meetings with the businesses. It's been very effective. And thank you to Cashew. We love your work. We love when you come to our office and respond to the people who need help there. Mari, doing great work. And Dr. Cullen, I am such a fan. Thank you, Mayor.
And thank you, council member. Yes, I want to thank all of you and Mari, Brandy, everyone that is on the ground doing this work. We also want to know what new tools have to be created. And, you know, like I asked, what other jurisdictions, what other organizations need to be brought to the table so we can start finding the solutions. It is terribly frustrating for everyone. I understand. And I thank you all for your day in, day out commitment to trying to find solutions to this. And I really, you know, I think that we need to, as the Councilmember Ulick said, distinguish what's what, right? What are the unsheltered individuals that have been evicted, need help? What are the unsheltered individuals that maybe are right now not accepting the help, but there's a criminal element there where they're either using fentanyl, burning, you know, in public, selling in public. We also, that's breaking the law. And we need to address that. And how can we leverage an arrest to be able to mandate you know, for them to accept detox. So, Mr. Manager, I don't know if you wanted to add additional comments.
Thank you, Mayor and members of the council. Happy to take that as direction to convene that gap analysis and putting together that mapping of both the systems, but that also leads to the mapping of individuals and how we help them across all of those different sectors, working with the regional jurisdictions and our partners. Also, any gap in communication or information that any of you feel that rests on my shoulders. So I'll do what I can to shore that up and make sure that none of you are ever caught off guard in the future on an action like what we took today. And I'll close with saying part of that will also be expressing what those metrics are, what are our goals, and making sure there's absolute clarity there. I think that's a fair comment that we need to make sure they're not just in our heads, they're actually in places where we're all working toward those same metrics and goals. So thank you, Mayor.
One last question so that we can make part of this gap analysis. I understand that the collaboration to end homelessness received around $11 million or 7.8, I'm not too sure, but how are we using this $7.8 million on behalf of the nonprofits that are receiving these funds? How are they how are they coming to the table, right? How are they putting that federal funds, those federal $7.8 million funds into work? And how do we make them part of the puzzle with those federal funds that they've received for our region? They have to be part of this conversation as well. Alrighty, thank you so much for everything. Really appreciate the update. Dr. Cullen, thank you so much for your visit. Really appreciate you. Alrighty, so we're gonna move back to item 1. Item 1 is time has been set aside for a discussion of the recommendations for the PAG Management Committee, the upcoming